Well, we are good to go. Yeah. So this particular class will be about the autonomic nervous system. And autonomic nervous system, I wanted to talk in quite detail, like a very much detail. But again, since it is I thought I would upload that video over the YouTube. You all can see that. Today we'll be seeing only what is important for us, like as a final year student for revision, and we'll be moving toward our next chapter. So we'll be seeing the autonomic nervous system in a very short glimpse, and we'll be seeing the central control. Okay, like how central control happens, or if central control you want in next class, then we can think of preganglionic and postganglionic also in a very short way. Okay, so autonomic nervous system, as you all know, uh, just yeah. So autonomic nervous system, that day also we discussed about sympathetic, para parasympathetic, and the enteric, basically for the GI tract. Okay, it is in the GI tract. Okay, then sympathetic, parasympathetic, and enteric. Enteric has also the two part. Okay, one is start like a myenteric, basically for just 1 minute. Alexa, stop. So myenteric, you all would have been knowing about orbis plexus. Okay, orbis plexus, that is basically for mobility, right? Mobility. So you can remember like M for myenteric and M for mobility. And then another plexus is like what? Anybody? Some mucosal. Okay, basically that. So this is what is the Meissner's plexus. Okay, so this is basically what? So mucosal is for what? Secretion. So what you will remember? You'll remember S for secretion, S for submucosal, and then same way M for myenteric and M for mobility. So this is how the normal division is. What we were actually thinking. I mean, that day we were discussing about, in a very short. So I just wanted to tell you about this, that how it goes, and now you all have to have patience for 2 minutes till I draw this. This is the schematic diagram of the brain. Many a times I drawn, so now you all are easily understanding. Sulcus and gyrus, I'll let you know how to draw. In a beautiful this one, I'll let you know. We have to draw up to down. Okay. So this is the cerebral cortex on top, and then these all of the part of brain stem. Okay, after the midbrain, the brain stem supported by cerebellum from behind. Okay, well, so now let us take it this area from down. Okay, from somewhere from here, let us take it down. Okay, so the area of cervical, then area of thoracic, then area of what is that? Lumbar, then the sacrum. Cool. And then at last is 1. So here I'll write 5. Here write 5. Okay. All these are numbers of, it's a pair of spinal nerves. Cervical, I'm writing 8. Everybody knows about it. Why 8? Okay. Cool. Understood. So, no problem. You make my work easy. So, one side I'm talking about sympathetic nervous system, sympathetic autonomic nervous system, and another side I'm talking about parasympathetic autonomic nervous system. You would have seen that. So basically, sympathetic nervous system, if you see, like nerves coming out from this, just one sec. So, like there is a 12 pairs of nerve coming from thoracic. Likewise, here it is. Okay. So if you see that particular, like a image, in that image, actually, can anybody tell me like what actually the speciality is there when we talk about sympathetic autonomic nervous system and parasympathetic, in terms of like how nerves from the spine it matters to them? Anybody? How nerves matter to them when it comes to the like from the spine, like how do we see that? So, like sympathetic is basically like it increases the heart rate, increases the blood pressure. It actually sent the blood from the skin and viscera to the skeletal muscles, because you need to run that day. You remember that I was giving you example like how like a cheetah runs, or how tiger, like how you will run seeing, getting scared. How that is how the blood glucose will increase, like your respiratory rate will be higher, your bronchioles will dilate more for getting more oxygen. Okay, your pupils will dilate. All these are sympathetic responses, right? Very simple. You should tell very quick. You should never delay it. You should tell quickly. Okay. But I'm not looking for this, because I understand that as a student you would have mugged up these things. I'm not worried about like what sympathetic nervous system does after all. No, what I want to ask you, like which level it does. you know it is always, remember, just make it black so that you can remember, it does at thoraco lumbar level. Okay. And parasympathetic autonomic nervous system works at cranio sacral, basically. Okay, always remember this used to be one of the question, like in pre-medical examination. So right from the +1 +2 age, I remember this thing very, like I actually remember this thing. So this is very very important thing what I'm saying you. Okay. Now, there are many things. If I say you, like pre-vertebral section, like okay, anyway, I'll draw the image on it, don't worry. No worries, I'll draw the image. I'm talking about pre-vertebral. Okay. So suppose there is celiac. Okay. This I'm talking about kidney. Okay, on top of kidney will be what structure? Anybody? Huh, correct. You're right. Adrenal medulla. Yes, yes, yes. You're right. Because sympathetic and parasympathetic are deeply related with all this. Okay, adrenal medulla. Very nice. Good. So this. I just collaterally I drawn the pre-vertebral level पे one diagram. Okay, so it's basically the collateral. Okay, just for one remembrance. But what was paravertebral? Laterally. Paravertebral. If I ask you, what about paravertebral? Okay, paravertebral laterally. Very simply, I'm just making you understand. It's very simple. So it will have what? It will have obviously sympathetic ganglion. What we will say the sympathetic chain of ganglion for thoracolumbar region. Where? For GI tract, pelvis, abdomen. Okay, so here it will be 3. Thoracic may it will be likewise 12. Lumbar may this lumbar region. Okay, anyway, this is thoracic, this is cervical, this is lumbar, this is sacral. Okay, lumbar may there will be 4, and sacral also 4 to 5 ganglions will be there. Okay, from these only the nerves passes through. Okay, anyway, I've decided we'll discuss the pre-ganglionic and post-ganglionic and confirm your like all the doubts. Okay, it's a very very important ganglion. What is ganglion? It is a collection of gray matter inside the white matter outside the CNS, right? This is the ganglion. If the same thing happens inside the CNS, what we'll call, my dear friend, nuclei. Very good, wonderful, wonderful. You remember this all basic concept. Wonderful, wonderful. Okay, this is the basic, like structure, schematic structure of sympathetic nervous system. How does it actually go? And when it comes to the parasympathetic, anybody? As I said, it's a craniosacral. Okay, so craniosacral means just remember cranial nerve number 3. Okay, just a minute. Cranial nerve number. I'll write it in Roman only. It will be easy for you to understand. Number 3, number 7, number 9, and number 10. If you remember, cranial number 3 means oculomotor. Number 7 means facial. Number 9 means glossopharyngeal. And number 10 is vagus. So you can just see that where it comes from. Number 3. Anyway, tomorrow I'll tell you more about it, or whenever we'll have class cranial nerve, we'll go into bit detail because cranial nerve is very, very important. Okay. It is like why it is important, because alone if you have a knowledge of cranial nerve and cranial nerve testing, you'll be able to tell which part of the brain is damaged for the patient. Okay, so cranial nerve number 3, basically what it will do, the ciliary part, it will control the ciliary part. Okay, and cranial nerve number 7, basically 7 is for what? 7 is facial nerve, very big nerve, and very very important. So like what exactly here it is important for? Submandibular and sphenopalatine, these two. Okay, so basically sphenopalatine is for what? Lacrimal lacrimal, like, what is lacrimal? Being sad, and then tears come out. Cool. And submandibular is basically salivary. Okay, salivary. Okay, number 9 here, what it will do? Number 9, think about it. Glossopharyngeal is for what? I'll wait for your answer, no problem. What parasympathetic activity the glossopharyngeal will bring? First year question. I know it's like it's not easy to remember. You might have forgotten, but let me tell you, it is very important to understand that. Okay, it originates from medulla oblongata and comes into the pharynx. Okay, and it is okay. Anyway, next class will give you even the mnemonics to remember, like which all nerves are mixed, which all nerves are motor only, which all nerves are sensory as well. Okay, so basically glossopharyngeal nerve parasympathetic function, if you understand, so that will be providing the, anybody, providing the innervation to parotid gland. Very very important. See, these things you have to remember, and it's not tough if you remember in systematic manner. It's not tough. Okay, so sensory part will be different, like it will be related to pharynx, it will be related to sinus, it could be related to one third of the tongue, you remember, posterior one third. Good. And it will be related even the ear cavity also, and famously called Eustachian tube also. Okay, and special sensory, you know very well, it's a sensation of taste, posterior one third of tongue. Parasympathetic, just now I told, it provides the parasympathetic innervation to the parotid gland. Good. And it has even the motor activity. Okay, innervates the stylopharyngeus, that is the small muscle in the pharynx. Anyway, we will be coming into this very much detail in coming classes. That's not to be worried. Okay, I'll let you know about it, but you should remember small things. Okay, so parasympathetic activity is very very important. Okay, fine, coming to the number 10, very famously for the our cardiac function, right? So our heartbeat, which was more seeing the dog, now it should come down and all because of because of vagus activity. Okay, now there is a, as I said you, like it's a craniosacral, basically the parasympathetic activity does it. Always remember S2, S3 and S4 nerve root, basically, which goes as a pelvic nerve. Okay, this is also very very important to understand when it comes to the parasympathetic activity. Okay, this was the common, like how the division happens and which level. Basically, if you remember this much also, that it goes on thoracolumbar region, it goes craniosacral region, it has these many. How will you remember these many nerve? You can remember the number like 3, 7, 9, 10, but this is difficult to remember. So what you have to do it, I'll tell you, it's very easy method. Method is, remember, 1, 9, 7, 3. Okay, 3 is the like cranial number, nerve number 3, cranial nerve number 7, cranial nerve number 9, and it is a cranial nerve number 10. Consider it as like a 1973. Okay, so 3 is a cranial nerve, 7 is a cranial nerve, 9 is a cranial nerve, and 10 is also the cranial nerve. Okay, 3, 7, 9, 10. So this is the parasympathetic activity carries by these nerves. Okay, we will be seeing in the detail in cranial nerve classes. Okay, don't worry. Now coming to this picture only, and getting it, like a little more detail, what all things it does. Let us we will be talking about sympathetic this side and parasympathetic this side. Okay, so what sympathetic does, it dilates the pupil. Okay, what it will do, constrict the pupil. Very easy to understand and remember now. Which cranial nerve will be involved here, dear friend? Number 3, oculomotor, right? So then I told you that day, there is a motor nerve, there is a sensory nerve, there is a mixed nerve. Okay, mixed nerve. So mixed nerve could be motor plus sensory plus or minus anything autonomic nerve, also autonomic system also. Understood my point? Always remember this concept. Motor plus mixed are always motors plus sensory plus, or it may be or it may not be autonomic nerve along with this. Okay? Always remember this. You will never get confused. Okay, fine. Coming back. Synthetic does what? It reduces the flow of saliva. What it will do? Stimulates the flow. Now tell me which cranial nerve again. You can understand that. Hmm? It increases the heart rate, it decreases the heart rate. Okay, again you can just see the contrasting difference, and then you can find out the trend of how big picture plays. Anyway, we'll be coming into that. How about the bronchi? It dilates the bronchi, that means it increases the respiratory rate and dilates the bronchi. My cardio class is also going to be on within 15 days possibly. So those who are interested can join. But I'm not talking about the final year students who have joined me today. Reason is like they have their own course, so they can carry on. Later they can in other batch. So respiratory rate decreases here and it actually constricts the bronchi. Okay. Now other things, what does it do? Sympathetic, what does it do? It will, through solar plexus, it will, what it will do, it will inhibit the submucosal secretion, and then it will inhibit the movement very popularly called as peristaltic movement. I hope everybody knows, right? And it will stimulate the peristaltic movement. Okay, just descend down the function across your, like a spinal cord, and you see how beautiful the things are. Okay, so don't think that you cannot do, you can do. Only thing that you have to have a confidence that you can do it. Okay, any more activity let us consider here? It will go for glycogen to glucose. That day we were saying, no, like seeing the big dog and then has to run. So what it will go for? Glycogen to glucose. What it is called as? Glycolysis. But at ulta, what it will do? It will do gluco, anybody, glucogenesis, है ना? ग्लूकोज से ग्लाइकोजन बनेगा and it will get stored in liver easily, right? Very nice. Now it will stimulate the release of bile. It's a beautiful system. Sorry, I made a mistake here. That's what I just stopped. It will go other way around. Okay. Yeah. So like what it will do, it is like the synthetic will always go for like a noradrenaline, you know, and adrenaline production will be higher. Okay. So this is how it works. Okay, basically this is how it works. Okay. So okay, now if I ask you, who will do constriction of bladder, parasympathetic or sympathetic? Parasympathetic. Okay, it will, by the way, inhibit the constriction of bladder. Okay, so this is how you should differentiate these two. Okay, so I think today we will stop here because other side people are tired. So in our next class, which I wanted to finish another 10 to 15 minutes, but I think they are not very cooperative for that. But oh, you can. Very nice. Then I have no problem. I can't guarantee it will take 10 minutes, but yeah. No, I just wanted to give you the fair idea of preganglionic versus postganglionic. Okay, you're tired. No problem. No problem. Let us finish. We will see in the next class. Okay. No, no problem. No problem. No problem. Next class. No worries. I took more time today. No problem. So, hope you understood that. So, Bika, is there any question from your side?